Pediatric Palliative Care. We have 2 other videos that talk about what this is and who we look after. In this talk, I'd like to just focus on what we look after. How can I help your child? When a child faces a life-limiting illness or a chronic illness, they could have pain, they could have nausea, vomiting. They may not mingle with other children. It may not be possible to mingle with other children. They may not be sleeping well. They may be constipated. They may not be eating well. Well, if you look at another child who is not facing any life-limiting illness, you would see that they would carry on doing these things without a second thought. But for a child who has these difficulties, it is a challenge, not just for them, but for the parents. Parents cannot eat if their child isn't eating. Grandparents cannot eat. The brother may not eat. The whole cooking in the house would change if a child is not able to do these things that everybody takes for granted. Can I eliminate everything? Can I make everything absolutely zero? Probably not, but we would be honest about it. We are not going to give you false hope, but the right hope. We are not going to tell you that there's nothing I can do. There is always something that we can do to help your child. And doing it in a manner that is friendly according to the age of the child is very important, because how a 2-year-old would deal with this problem is not the same how an 18-year-old would deal with the problem. And how we talk to them is not the same. How we talk to a 2-year-old and how we talk to an 18-year-old is very different. The thoughts of a 2-year-old, a 5-year-old, a 7-year-old, a 12-year-old, an 18-year-old are all different. So if we have to look after a child, it has to be according to their age, according to how you want to bring up your child, according to how the society around looks after your child. If we do not do it in this way, then we will fail. But how do we do it together? How are you supposed to bring it all together? In pediatric palliative care, we do it in an interdisciplinary manner, meaning I am a doctor, I have a nurse, I have a psychologist, I have a nutritionist, a physiotherapist, an occupational therapist, speech and language therapist. Each of us come together to work as one with your child as the center of care to provide the best quality of life possible. If you are facing with any difficult situation, like I mentioned earlier, where your child has a chronic life-limiting illness, do come and meet us at Aster CMI Hospital. As a pediatric palliative care department and team, we would look after you and help you to the best extent possible.